Hi everyone, we're back with my first guest, Dr. Rebecca Berens with Vida Family Medicine. Hi, how are you today?
Good, thanks. Thanks so much for having me.
And I will say that, I personally do use Dr. Berens as my doctor, so, it's kind of a double, thing to let y'all know about the services she provides, because I think she's an amazing doctor. But tell me a little bit about yourself personally, and then we'll go into all your practice and stuff.
Sure. So I grew up in the Houston area. I grew up in Richmond, so just outside of Houston. I went to college here at Rice, and then I went to Baylor for med school. I was away in DC for a residency, and then I worked in Philadelphia for a while, and then came back home. And so I live here in the Houston area with my husband and our 2 children and our rescue pit bull and our cat.
Awesome. So kind of what made you go into medicine? Like, what made you want to be a doctor?
So when I was in college, I actually wanted to do cancer research, and that was what I planned to do because my grandmother died of ovarian cancer when she was very young. She was only 57, and one of her sisters also died while I was in medical school of breast cancer. So there was a lot of cancer in my family, and I really wanted to do cancer research for that reason. But when I was in the research lab, I felt very disconnected. Like I wasn't really helping anyone because I wasn't seeing patients. I was literally dissecting fruit flies. Didn't feel very connected to helping any patients, and that's what I really wanted. So then I sort of revisited my goals, and I decided that a career actually in medicine would be a better fit for what I was hoping to do.
Yeah, because in that sense, you could actually talk to the people and kind of make sure they're getting tested, make sure that they're getting all the things they need in case they do have something, and have that one-on-one connection with them and everything. So what made you decide to kind of open your own practice and go this direction?
Yeah, so when I was practicing in a health center in the Houston area, and I was also teaching medical students and residents, and I loved it. I loved the patients. I was seeing a wide variety of patients, all ages, and doing a lot of great work, but I was feeling very crunched for time. In a lot of health centers, you get booked every 10 to 15 minutes, very close together, or even double booked. I didn't feel like I really had the time that I needed to spend with patients to explain to them what was going on with their condition, how they could take better care of themselves, explain the medications that I was prescribing. And so it felt very rushed, and it didn't feel good to me. I didn't feel like I was giving them the full benefit of what I could provide them.
Okay. So that's kind of, you're a primary practice where you can just, I guess it's a fee-based practice, which we can explain, but also kind of, I think from what you explained earlier, the research and all that, that this gave you kind of that one-to-one. And yeah, sometimes you go to the doctor, plus you wait. Like sometimes, I know for me, it was always frustrating to just call, and it would take like 2 weeks to get into the doctor. And then by that time, all of a sudden, okay, well, I don't feel what I felt, or, what if the problem's more emergent than that, that like whatever I'm feeling, I think casually about it, but it really needed more attention. And so I think that's kind of what the difference is too, about going whether, to your type practice or, but I guess explain to everyone what the difference is between going to and what your practice provides.
Yeah, so my practice is a membership-based practice, and so I don't bill any insurance company, so I am not restricted by the insurance company in the care I provide. So I don't have to designate only a certain amount of time per patient. I don't have to overbook myself to try to keep up with all of the demands administratively from insurance. And I can schedule people for as long as they want. We can talk about things in a way that works best for them, rather than, this is what your insurance company covers, so this is what I'll do. I can really spend the time with them and be available to them. So in most insurance-based practices, like I said, they schedule people back to back every 10 to 15 minutes, trying to make sure that they see enough patients in the day to cover their administrative costs. In my practice, because I don't have to deal with that, I maybe only see 1 to 3 patients in the office per day. So I'm available. I can get people in the same day or the next day if they're sick. If they have a quick question that they want to text me, I can answer that question, so then they're not going and Googling it and getting all freaked out. by whatever Dr. Google tells them. I can actually, as their personal doctor, explain what the answer to the question is in the context of their own health.
Yeah, and you can also, I mean, I know we talked via Zoom, we talked in different ways during COVID, which I think everyone has experienced that during COVID. It was really difficult to get in and to see doctors and actually get that kind of service that you actually want, which is that one-to-one connection. And, I mean, this might be TMI or something, but when I was thinking about having a child and stuff when I was a little bit older, I was kind of surprised. I went to a new doctor and I was surprised that they didn't ask me, being at the time 35 years old, I was like, wow, that person did not even ask me if I was thinking about having children. I've been married and all that stuff. So that was an instant to me in my mind, like, I need to find another doctor. Because, that should be, with what you do for a living, that should be your first question, Like, what are you thinking about, family and stuff like that. So I think that's really unique with your practice that you can, I had never experienced that before, just kind of one-on-one and being able to text you, it's just like, okay, I need, a refill on this. And you're like, well, what are you feeling? Why? Blah, blah, blah. And then, you're like, okay. And so it got called in and it was really quick and easy. So, and you're always available to be reached. So that's awesome. What type of patients are good for your practice?
So a lot of the patients in my practice are small business owners, entrepreneurs, self-employed in some way, and they don't have access to the traditional health insurance benefits that come from a big corporate job. So their options are more limited in terms of what they can access from healthcare, and their time's also limited because they're trying to advance their business, and so they don't have time to be sitting in a doctor's office for 2 hours waiting for a 5-minute appointment. So I have a lot of patients who are in that entrepreneurial or self-employed space, and they'll have a membership in my practice, get their health needs taken care of, and then they have some kind of supplemental catastrophic coverage for big emergencies that I can't handle in the office.
Okay. And things like, that are covered by your traditional, like blood work and prescription discounts and all that kind of stuff, and you can provide that kind of stuff to patients as well?
Yeah, so unfortunately in Texas, I can't dispense medication from my office. There are practices like mine in other states that actually dispense wholesale medications to their patients. I don't have that ability here, but I do offer discounts on lab work. So I have a lab partner that I work with, and they basically bill me instead of the patient, and because I pay them every month, they give me a discount, and then I pass that discount to the patient. And then I also help patients to find the most affordable prescriptions. So there's a lot of resources I can provide to help them find which pharmacy is going to have it the cheapest, and is there a discount card or something they can use to make sure it's going to be affordable for them.
Which is awesome, because that means they're not really missing out on kind of anything from having the big, insurance, big insurance providers. What patients are not good fits for or do you have patients that aren't good fit for your practice?
Some patients, I think most patients who join my practice, they want to take their health seriously, and they want to take care of themselves and take care of their health, and they really value their health. There's some patients who they just want to go to urgent care and get some antibiotics when they're sick, and otherwise they don't want to talk about that kind of stuff. And I might not be the best doctor for them, because I really want to take a holistic approach to people's health and talk about not just what's going on right now, but how can we be proactive to prevent health problems in the future. And not everyone's ready to have that discussion, so that might not be a good fit for the type of practice I'm in, because I love having those conversations. But certainly I try to meet every patient where they are. And if they're not ready to have those conversations, but there's something else they're concerned about, I want to take the time to address their concerns, and then later we can have later discussions about being more proactive or preventive.
Okay. How often do you do like a yearly checkup with your clients, or what's kind of the process as far as being a member with your practice?
Yeah, so whenever someone joins as a member, I have an initial consultation with them, which is usually about 60 to 90 minutes, where we take a really comprehensive look at their health history, their any previous medical conditions, their family history, their diet and exercise, if they smoke, if they drink alcohol, all of those things that might impact their health. And I kind of come up with a plan of, okay, these are the preventive care things we need to address, and then any concerns that they're having about their health in that moment we'll also address. So at least once a year, I like to have that visit with patients where we take that really comprehensive look. And then depending on if they have any chronic health conditions or what concerns they're having going on at the moment, we'll develop a follow-up plan as well. So people who have maybe say diabetes or high blood pressure, I would want to see every 3 months. Someone who may have a more acute healthcare issue going on, I might see them back in a couple of weeks to follow up. It just sort of depends on the situation.
Okay. Do you work with employers to like help get their employees insurance coverage, or help, I guess, not insurance coverage because you don't work with insurance, but to get, help with their employees, or, provide them with the service?
Yeah, so actually small employers are a great fit for the practice because usually they can't afford to do like a full, PPO, great health plan that a lot of the big corporate jobs offer. But they can actually build a really affordable but still very broad health coverage plan with a membership at my practice, and then either a self-funded plan or some kind of supplemental catastrophic coverage plan for their employees. So the majority of their care comes through me, but then if they do have a larger need, they have this kind of backup coverage. And I have a few people that I work with who can help build that sort of plan for an employer. So I focus on taking care of their employees, and then the partners that I'm working with will help to make sure they're covered in the case of a big emergency.
That's awesome. Because I know even like myself, I do have big, insurance through my husband's employer and everything, but I still use Rebecca as well because, once again, I don't have the time. I am self-employed. I don't have the time to go and make 10 appointments to do, go to the gynecologist for this, go to this for this, go to this for this, and each person does their separate thing. I like that Rebecca provides it all for me. So that's what's nice, is that I can go and do my 1 year women's health, tests. I can do my blood work. I can do everything. I don't have to go to each individual doctor to go get that. And then on top of that, you're paying, whatever, $32 or $30 every time you go. So that adds up, too, to do that, even if you're doing it just yearly. So I think just kind of for me, it was more of the being able to, accessibility, being able to get a hold of you and be able to text you. And when I'm busy, I don't have time to think twice about what I'm doing. Like tomorrow, I was like, I don't know if my client's going to need me. Yes, you do need to carve out time, but I don't know if my client's going to need me at that time or something. So I want to be able to see them and, provide that information. So what's the best way for people to get a hold of you or get into your practice or find out more information about your practice?
Yeah, so through my website, which is www.vidafamilydpc.com, there's a place where you can go to enter your email, and we'll contact you with more information and give you a link to schedule a meet and greet if you want to ask us some questions and more one-on-one. Or if you read the website and you're ready to go ahead and enroll, you can do that directly through the website as well. Our phone number also accepts text messages, so we also encourage people, if they have a quick question and they just want to ask a quick question, they can go ahead and text us at 713-766-4496.
Awesome. So, are you constantly updating your information on your website as far as what's going on? I know COVID's been like kind of crazy. It's been a crazy 2 years, just with everything that's happened. And I think all of us had never expected something like this to happen in our lifetime. And I know we're always quick to listen to the news or quick to listen here, but obviously getting it from a doctor, it seems more credible than just watching news sometimes. Do you constantly do updates?
Yeah, so early on in the pandemic, I was actually doing a weekly newsletter to my patients because things were changing so quickly and I was trying to keep up. So it was helpful to me actually to have every Friday I sent out an email. This is what happened this week. This is what this means, in a nonpartisan, non-political way, just like this is the facts. And so I was doing that weekly. Towards the end of the year, I started spacing that out. So now I send out a newsletter monthly. And I do have a place on my website where I've collected some quick links about different COVID things, like places for testing centers, vaccine sites, that sort of thing. Although recently the things had kind of calmed down, so those weren't needing to be updated as frequently, but yeah. I'm going to be updating those more frequently, certainly now that Delta is an issue.
Yeah, we're picking up again, unfortunately.
Yeah.
So it's definitely on top of mind again. I think people are getting, I obviously think people are just getting a little too lax, as far as not wearing the mask, not washing their hands, doing anything. Oh, it's gone. It's like, no, it's not gone. And here we are with a new variant of it, that we don't know if the vaccine kind of works on it or doesn't work on it, or, you hear all these different things, which vaccine does, is more effective than the other. I think it's all still up in the air. So, I definitely appreciate getting the updates and knowing what's going on. So,
yeah.
once again, thank you for coming. Dr. Rebecca Berens of Vida Family Medicine. Definitely look her up and give her a call if you're interested. Thank you for coming.
Yeah, thanks so much.
We'll be right back.